Hello everyone, this is Erin Schneider at CityMatCH, and welcome to the CityMatCH Learning Network webinar. Today we're featuring speakers from Family Voices, the Texas Parent-to-Parent program, and the Texas Department of State Health Services. So just a few housekeeping tips before we get started today. Please make sure your phone line remains muted during the call. You can mute your line by pressing *6 on your phone, and you can press *7 to unmute. You can also send questions or comments to the chat box. I'll be monitoring that throughout the presentation. At the end of the presentation, we'll go over any questions that you have for any of our presenters. Finally, if you experience any technical difficulties during the call, you can call the ReadyTalk customer care line, which is on your screen. So without further ado, I want to introduce you all to our presenters today. Jennifer Bolden Pitre from Family Voices, Sherry Santa from the Texas Parent-to-Parent program, and Rachel Ju, the Title V Children with Special Health Care Needs Director at the Texas Department of State Health Services. So Jennifer Bolden Pitre is the National Program Coordinator for Family Voices, a seasoned parent advocate for children and youth with special health care needs. Jennifer lives in New Jersey, where she leads Family Voices work on Zika and works across projects supporting the national organization in the states and works in the territories, including Puerto Rico, the U.S. Virgin Islands, and American Samoa. Jennifer is also the liaison to the AAP Council on Children with Disabilities, liaison to the Friends of the National Center on Birth Defects and Developmental Disabilities, and serves on the American Board of Pediatrics Subspecialties Committee and a family faculty member of the AAP's ECHO Zika project. Jennifer has been a member of the New Jersey Bar for 22 years and currently serves as a member on the Health Law and Minorities in Law committees. So welcome, Jennifer. Thank you.
Good afternoon, and welcome to today's webinar, Supporting Children and Youth with Special Health Care Needs Impacted by Zika and Providing Community-Based Support, how Texas P2P is addressing the Zika virus in Texas, Texas P2P, and the Texas Department of Health Title V collaborate with families impacted by TED. Today's webinar has 4 learning objectives, including the following. Overview of Family Voices and the National Center for Family Health Partnership. Share resources for communication and psychosocial support to families. Identify high risk for Zika virus infection. Showcase a collaboration between Texas Maternal and Child Health and Texas Family Health Information Centers. Family Voices is a national grassroots network organization of families and friends of children and youth with special health care needs and disabilities, promoting partnership with families, including those of cultural and linguistic diversity, in order to improve health services and policies. Okay, so Family Voices believes in social justice and promotion of health equity. Authentic care that recognizes families, children and youth with special health care needs and their families become empowered self-advocates, and family engagement in prevention, health, and wellness in clinical and community settings. Next slide. Here are some of our partners. There are between 11.23 and 14.6 million children and youth with special health care needs in the United States. These families are faced with many challenges. Family Voices state-affiliated organizations, we call them SAOs, and family-to-family health information centers, F2Fs, provide critical support to families caring for children and youth with special health care needs, particularly families of children with complex needs and those from diverse communities. Last year, our F2Fs provided information to almost 1 million families of children with special health care needs and over 350,000 professionals. To serve families of diverse backgrounds, F2Fs host support groups and conferences in multiple languages, create culturally competent materials, work with community liaisons, and provide leadership training and support. We are comprised of a network of 51 state-affiliated organizations and health information centers that span across the U.S. Here's a look at our map, including the District of Columbia. At the national level, we provide families with resources and support to make informed decisions. We provide national webinars and trainings. We advocate for improved public and private policies. We build partnerships among families and professionals and collaborate with national organizations. We serve as a trusted resource on health care information. Next slide. Our family leaders live in the communities they serve. They are often parents of children with special health care needs who have first experience and training navigating the very complex health care systems. Our family leaders know that parents of children with special health care needs often manage economic, financial, personal, and social burdens that are beyond those experienced by a parent with a typically developing child. These families experience more stress. Our family leaders provide support by providing direct referrals, in-person support, webinars and training, conference calls, and advocating for systems change. Additionally, they reach families through listservs, emails, and social media. At the state level, each state is different. The Stone Group of Alaska is different and diverse from SPAN of New Jersey, which is different and diverse from Utah Family Voices, which is different and diverse from Family Voices of Indiana and the Institute of Disability Studies at the University of Mississippi, because we love that each state affiliate has its own flavor, because we know that Mississippi is so very different from New York. But what they do have in common, and what we are so very proud of, is that they are staffed by families who have children with special health care needs, who have expertise in federal and state, private, and public health care systems, and they have definitely navigated those systems. And they work with professionals who also work with those parents. And our staff is culturally diverse and connected to the communities they serve. Next slide. Zika. It is remarkable how surprising Zika has been. This is the first time we have had a mosquito-borne infection that can cause a devastating birth defect. Tom Frieden said that statement. He's the former director of the Center for Disease Control from 2009 to 2017. Next slide. So here's a map of the United States, and I think we're all pretty much familiar with this map and how you can go into the CDC site and look up the number of cases. And I think what has changed is that how those cases are tabulated since 2017 is a little different. Zika records are kept as of January 1, 2015. And it became a notifiable condition in 2016. Zika cases are reported to the CDC by state, territorial, and local health departments using standard case definitions. And according to case records on the site today, there are 5,292 symptomatic Zika virus cases reported. 5,020 cases in travelers returning from affected areas, and 224 of those cases were required through presumed mosquito-borne transmission. 48 of those cases through other routes, including sexual transmission. Now, what I will say with regard to that is that I would encourage you all to go to your own states and look and inquire as to the specific state data. Because what we do know that across the U.S., the CDC has also reported that 1,500 pregnant women were found to be infected with Zika and 64 infants were born with birth defects. We know that in New York, a quarter of all infants in the U.S. were born with birth defects related to the Zika virus, and that was in New York City alone. We know that in New York, 402 pregnant women have been infected with the Zika virus, and that 32 infants had the virus, and 16 of them had Zika-related birth defects. And I was looking around just today for updated statistics, and of all updated cases, there are 993 human cases positive for the Zika virus, the travel-related cases. And there are now 406 women with laboratory evidence of Zika virus with pregnant women. And of all the cases reported, 788 of those cases are cases involving women. So the Zika virus has been a game changer for all states. And in Florida, a state that keeps up to the date cumulative cases, they have reported 1,402 travel-related cases, and the pregnant women, 268 cases. Next slide. Psychosocial Support Lay Council. Actions which address the social and psychological needs of individuals, families, and communities, which aim to enhance the ability of people to bounce back and restore normality after adverse experiences. We know that Zika information is constantly changing. Therefore, you need to try to be up to date with the latest scientific information on the Zika virus and its potential consequences. If you have websites on your site and on your pages, try to keep your literature up to date. Be aware of the latest guidance on assessment and management of the Zika virus and its potential consequences. Be sure that your handouts and outreach materials reflect the latest guidance. And this is fairly easy by linking to the CDC website. Get acquainted with available services and support, referral systems for people and their families affected by Zika virus infection during pregnancy and or for microcephaly. Get acquainted with the medical neighborhood of the families you serve. Link with your local Family Voices Health Information Center, ParenttoParent, or affiliate so that you have a cultural bridge to the community. I can't stress this enough. When people are in stressful situations, they want services and they want support, and it's always in that order. Have staff that interact with the community reflect the community you serve. Next slide. Health information should be conveyed in a manner that considers people's well-being. Information should be culturally competent and display pictures, posters, and other materials that reflect the cultures and ethnic backgrounds of children and families served by your region or in your area setting. Otherwise, it's really a disconnect. Be accurate and informative. For example, that babies with microcephaly do not develop developmental disorders or other severe neurological complications. Help with decision-making if you're able, or if not, send them to someone who can. Be health literate and easy to understand. Educate about the prognosis of Zika or microcephaly or other neurological complications if you are able, or send them to people who can. Link to stress management supports, aids, and resources, and you can do this on your website. Share information about and refer people to relevant services to address social, psychological, and physical health needs as appropriate. Next slide. On the front line, local government. Local governments and MCH professionals are the frontline defense protecting women and children affected by the Zika virus. MCH organizations can find more creative ways for local Department of Health to collaborate with local F2Fs and Family Voices SAOs to improve outcomes for pregnant women and babies impacted by the Zika virus that align with MCHB activities. Meaningful family engagement of a local family-to-family can be instrumental in reaching MCH populations, particularly diverse and underserved families who are challenging to reach. After all, Family Voices and Family Voices affiliates are the boots on the ground. Community-based outreach, care, and support is central to the Zika local response. Next slide. In May 2017, the CDC updated the CONUS guidance targeted to state, local, and tribal jurisdictions responsible for responding to the Zika virus disease in their communities. We see opportunities for collaboration with Family Voices state affiliates and F2Fs. Here are some examples. Outreach to pregnant women in the community, sharing Zika prevention and education information, outreach to vulnerable populations, assistance with reaching community stakeholders, assistance with creating and reviewing culturally competent materials, and referrals on a case-by-case basis per HIPAA requirements. Next slide. Priority Department of Health jurisdictions, sorry about that. Department of Health and Family Voices, family-to-family, and SAO collaboration may be a particular value add in jurisdictions identified by NACCHO and CDC as vulnerable for potential impact resulting from Zika, such as Alabama, Arizona, California, Florida, Georgia, Hawaii, Louisiana, Texas, Mississippi, and Los Angeles County. Next slide. Zika Care Connect, which is a fabulous website developed by the CDC and maintained in collaboration with March a Dime, establishes a network of specialized healthcare providers who can care for patients and families affected by Zika virus. Zika Care Connect has identified 10 high-risk jurisdictions: California, Florida, Georgia, Maryland, New Jersey, New York, Texas, Virginia, Puerto Rico, and the Virgin Islands. Next slide. And at this time, I would very much like to introduce Mrs. Sherry Santa, who is the Medical Education Program Coordinator at Texas ParenttoParent. Sherry has a passion for her work from firsthand experience raising her 6 children, and she lives in Pflugerville, Texas. Sherry?
Hi, this is Sherry. Can you guys hear me okay?
We can, thank you.
Perfect. First of all, thanks for inviting me to share more about Parent-to-Parent in Texas. Yes, we are definitely on that list of places that we are dealing with Zika every day, or at least learning more every day about it. Here at Texas Parent-to-Parent, our headquarters is in Austin, but we cover the whole state of Texas. And a lot of our families are in the valley on the Mexico border, and so we are really working on trying to make sure we are there to support parents. But just a little bit about Texas Parent-to-Parent. Parent-to-Parent started about 14 years ago around the kitchen table of a couple of parents that said, you know, we are not the only ones. We know there's other parents out there that are going to need support. Now, 14 years later, we are growing from that little kitchen table to an actual staff. We have 6 full-time staff and many part-time staff. I think we have a total of 24 now. But the great thing is we're all parents of children with disabilities or chronic illnesses or other special health care needs, including preemies. And from that very beginning, sitting around the kitchen table, parents have been doing this for years, even before it was formally a parent-to-parent. Any parent with a child with a disability ends up doing even parent support in the therapy waiting room, in the doctor's waiting room. It is amazing when you get to meet another parent who understands what you're going through. And one of the things we want to do when families do call in with babies with congenital Zika syndrome or some condition that could be related to congenital Zika syndrome, we want to be able to help those parents. Next slide, please. And the reason we want to do this is because we want them to not be out there all alone. That stress and isolation, decreasing that is probably one of the most important things when a parent gets a new diagnosis, no matter what that diagnosis is, or they're changing into some other part of their life. But we want to increase their confidence, emotional stability, and skills of the families, provide a place where families can get answers to specific questions, and increase the family's knowledge and access to resources. And then we do help families find or create resources for support and provide the technical support to families or parent groups. But again, for me, I think the biggest thing is making sure that, again, no matter what the disability is, that we have someone that can talk to that parent. When someone calls into Texas Parent-to-Parent, the person answering the phone is always another parent. It doesn't matter if we are a doctor, nurse, therapist in a former life. When we answer the phone here at Texas Parent-to-Parent, we are answering from the parent perspective. Next slide, please. A few of the things we do, parent matching is one of our big things. I was that parent that called in years ago needing some emotional support. I remember I called in and was crying for the first hour, and I didn't know that I even needed to cry. But at the end of that, my person that had answered was able to guide me through the process of what it was I was really looking for. And for me, I was looking for support in school and how to go through the IEP process and be more effective for my son. The other things we do are trainings around transition, advocacy, our Medicaid waiver programs, and People First Language. We also have a statewide parent conference, which, as you can see, just ended this past weekend. So that's the reason I'm stumbling over some words, still a little tired. But it was wonderful. Just like meeting a parent over the phone, getting together at conference and seeing kids like yours, seeing families like yours, it's just a major life changer for many families. We had lots of families come up to us that were first-time conference attendees that shared wonderful stories with us about how for the first time they didn't feel alone or that they were the only ones with a child like that. We also offer 3 one-day conferences. Again, the geography of Texas and how large we are, we need to spread out a bit so we can get to all of our families. So we have a one-day conference in East Texas, one in North Texas, and then one in the Valley. Of course, in the Valley is where we're really concentrating in the Brownsville, McAllen area. Those have been high alert areas for Zika for a while now. So we're trying to make sure that our parents there get all of the resources they need, understand that we're here for them for parent support. Each quarter we do a newsletter. You can see at the bottom there, quarterly newsletters. We have been writing about Zika for the last couple of newsletters, writing about prevention, the importance of it, and the importance of what to do if you do have a child that's been diagnosed. We do have a listserv for our parents and family members. We decided to add a professional one separately, and we do moderate our list, and it gives the parents a way to talk and ask questions, especially if they're not ready to reach out in person yet. Sometimes people are more comfortable just reaching out via email. And then our resource directory on our new webpage, which our brand new up-to-date webpage just launched, I believe, right in the middle of conference. I haven't spent much time looking at it, and then the quarterly newsletters. Next slide, please. A few of the things that we do at Texas Parent to Parent, this is just our programs, and they all revolve around helping the family as a whole and helping people in the community help our families. Our medical education program, which is what I'm the coordinator of, is a program where we work one-on-one with young residents during their pediatric rotation or young third-year med students during their pediatric rotation. They get a chance to see our families in their home environment, in their community, and spend time outside that exam room for those few little moments. The next thing we do is the NICU network. It's the only one that's not disability specific, meaning as long as you've had a baby in the NICU, whether it's 72 hours or 72 days, it doesn't matter. If you drive away from the hospital without your baby, you are a NICU mom or dad, and we understand the need for emotional support when you have to do that. The other is the Parent Matching Peer Parent Mentor Program. We've trained all over the state, and most of our matches are made via phone or email or Facebook or even texting, especially our NICU moms like to text each other, and that way we can be matched up. We are not disability specific, so anything from ADHD to Zika, we can probably find someone to match you with. On the Zika thing, just for a moment, of course we don't have a Zika family to match right away, but we have plenty of families that would be able to match on the co-occurring conditions related to Zika, such as microcephaly and other conditions that we could help them with. The next one is Texas Advocacy Network. Of course, we've been very busy. Our legislative session just ended. We have Linda and Amy, who are our advocacy group, and they really help parents go through the process of learning how to be effective advocates for their families. We do not support any specific legislation. We, in turn, just help families, do that 3-minute Senate testimony or hearing whatever you need to do, or how to make the most out of your visit with your legislator. And then pathways to adulthood, because our children grow up. We have transitions all throughout our children's lives, from ECI to PPCD to into kindergarten, and then the dreaded middle school, high school, and then out of high school or out of the 18-plus program that we have here in Texas. So we have school transitions, and then we have medical transitions. We don't get to stay with our pediatrician forever. We need to transition to adult doctors. I kind of stumble over that because it's one of the hardest things for parents sometimes to do, including myself, is prepare for the transition. And we are headquartered here in Austin, Texas, the best place to be in Texas, by the way. And it's nice because we are very centrally located, and we can go all over the state. I do want to mention that we have had great support from our Title V group, and that's actually how we got our Zika grant, was with Title V and the Texas Birth Defects. And our grant was to help get the word out to parents about Zika and about prevention. We've got all of our brochures in English and Spanish, and we're going to be there for the parents in 3 years when they start showing developmental delays, in 5 years when they're going into kindergarten, and in 14 years when they're transitioning into adulthood. We want parents to know that we are there no matter what they're going through as a family. And that's pretty much all about me and Texas Parent to Parent. Next slide, please. That is my contact information. If you need more information or would like to see our brochures or resource list, how we do those, just to give you a better idea of how we do things.
Thank you, Sherry. That was wonderful. And now I would like to introduce Rachel Jew from Texas. Rachel is the Title V Children with Special Health Care Needs Director. She's the manager of Children with Special Health Care Needs System Development Group from the Texas Department of State Health Services. Rachel?
Rachel, you can press *7 to unmute your line.
Hi, can you hear me?
We can, thank you.
Okay, great. Well, thank you all for having me. It's really a pleasure to be able to share what we're working on around Zika, in particular connecting these families who've been affected by Zika to needed services. So I first just want to acknowledge all of our partners in this effort, in particular the Texas Birth Effects Epidemiology and Surveillance Branch, without whom we really wouldn't have the epidemiological support to carry out these activities. And then, of course, a special acknowledgement to Texas ParenttoParent for their very important participation in reaching out to these families affected by Zika. Next slide. So I'm not going to spend a lot of time on this slide. Really, just to introduce that our first opportunity for collaboration around this topic with our Birth Effects Branch really started when they were awarded a CDC surveillance grant. In particular, we knew that we could provide some assistance in examining referrals and evaluating outcomes of babies with birth defects. But our I would say more intentional collaboration really began once they were awarded the microcephaly Zika grant, which I believe is on the next slide. So our Birth Effects Branch stipulated in their grant that they would be conducting rapid ascertainment of microcephaly and other Zika-related conditions, and we knew that we could offer our resources and expertise after ascertainment had been conducted and these families needed a connection to services. And next slide. So we brought together a group of folks to get us started in thinking about what the system of services looks like for these families, and what we ended up with was a visual flow chart really that depicted the system of services, which is on the next slide. So starting with the family in orange, no matter where they enter the system, we want to make sure that for these families affected by Zika with evidence of Zika, that they're captured in the Texas Birth Effects Registry and then connected to local services where they can receive some comprehensive individualized case management services. And the very important part there is that we want to make sure that each and every one of these families is connected to Texas ParenttoParent so that they're receiving that direct family support and are able to connect with parents and get that family perspective. The next slide. I apologize, this is a really confusing slide. So these are just two images on top of one another that extend some explanation of the flow chart. So we wanted to make sure that anybody who was picking up this flow chart was able to discern what each group would be responsible for, and just provide a little description of the types of services that these families might be referred to. Next slide. So we really felt like we needed to start a little small and pilot this effort that was depicted in the flow chart. And in partnership with our Birth Effects Epidemiology and Surveillance Branch, we had identified a small group of infants who had been born since July 2016 and were in need of services. So what we plan to do is, hopefully in the next month, obtain case information of these families and connect that data with vital statistics data. So we want to ensure that these families who we're reaching out to have not already experienced the death of their infant, because we know how sensitive that is. So as soon as those analyses are conducted by our Birth Effects group, then we'll be sending out cases, those cases of infants with evidence of Zika infection out to our regional offices all across the state to provide that case management to families. And then where Texas ParenttoParent comes in is we will be asking each of these families if they want a connection to another parent. And Texas ParenttoParent will be reaching out to the families as the families are providing consent to provide that additional support. So this is all very exciting for us. I think that we have very strong partners in Texas ParenttoParent, in our birth effects epidemiology surveillance branch, and even at the national level to continue to encourage us to move forward in this area. We've had hit a lot of roadblocks. I think that's just because there are so many unknowns with Zika right now. But we're really looking forward to seeing how this pilot pans out and where we can make improvements moving forward. So that's all I have, and I'm happy to answer any questions.
Thank you, Rachel. Okay, so that concludes the presentation. Here are some resources that we hope will be helpful. And now we'll open up the lines for questions.
And this is Erin. If you'd like to answer or ask a question, press *7 to unmute your line. While we're waiting for people to chime in, I had a couple questions in the chat box. One of which was, do any of you know if there is a parent-to-parent contact for Alameda County in California, in Oakland or Hayward, who is Spanish-speaking? Not sure if any of you know that information, but maybe you could tell Julie where she could find that information.
Yes. Alameda, California. So in California, we have California Voices, Family Voices of California. We have an F2F and an SAO. And they can find the link on the Family Voices website. I think they might be based in San Francisco, but I think they are statewide. So I can put the link, I can send the link. I guess, can we put a link in here?
You could do it in the chat box. And then you could,
email?
Or yeah, I could do that as well.
Right. We can send the link out after the email, or you can find the link at Family Voices or at NCFPT, familyvoices.org. Let me see where you can. Actually, the link will be on these resources here. Let me see. The first page of the resources where it says find your state affiliate. Let's see, go up to the next page in the resources. The first page of the resources.
Oh, yeah, I'm sorry.
Mm-hmm. Okay, where it says locate your state partner, that second resource link, if you go to that link and click into your state, there's a drop-down menu where you can go directly to the state of California. You will be able to find your state partner for California.
And this is Sherry. You can do the same on P2P USA. California has Parents Helping Parents, and then they have a community member called Parents Can.
Mm-hmm.
Okay.
Yep.
Thank you both. Another question we had, and I don't know if any of you will be able to answer it more from a national perspective, but what is the linguistic and ethnic data of those affected with Zika?
so that's a very good question. So I don't personally know the question. Are they asking for what are the numbers? Is that what they want to know, like the numbers of linguistic, the numbers of minorities affected by the Zika virus? Is that the question?
Yeah, maybe.
The linguistic part is throwing me off. So.
Yeah, I think it's probably the race and ethnicity of folks affected by Zika.
Yeah. So I don't know the exact answer to that question, and that data is increasingly difficult to get. I would encourage them to go to the World Health Organization website to obtain that. They might be able to get that information there. It might be broken down. I know that they break it down by territories. I'm not sure if it's broken down by ethnicity.
Yeah, and I don't know. This is Erin. I don't know if that information on the CDC website or not. I don't think that they have that. But.
Right.
This is Rachel. I know in Texas we do, for infants at least, we do have data about ethnicity, and we might even have data about preferred language, but it's not something that we have widely shared up to this point. I do know also, I can tell you that in Texas we are a very ethnically, racially diverse population, and in particular for children with special health care needs, about 30% of the population of children with special health care needs in our state are predominantly Spanish speaking. And given that many of the cases that we've identified have occurred along the Texas-Mexico border, that might be the case that many of our families are perhaps Hispanic and Spanish speaking.
Thank you. I have one more question. Is there information on the number of infant deaths or pregnancy losses related to Zika exposure?
We do in Texas keep track of the number of pregnancy outcomes and infant deaths associated with those outcomes.
Yes, and I know that information is, I believe, reportable to the CDC as well, isn't it, Rachel?
Yes, for any pregnancies, yes, they should be reported to the U.S. Zika Pregnancy Registry.
Right. So that would be in, I think the way the CDC reports that out is in, I think the terminology that they use is births that have been, I think they call it ended or otherwise ended or something like to that effect. So we don't know how, but that's how it's stated.
Mm-hmm. Well, that's it for the questions in the chat box. Do you have any questions on the phone line? You can press *7 if you have a question you would like to ask. Well, this is Erin. I have a question. I was just wondering what you all think is maybe one key thing that local health departments should be thinking about when they are working with families that have been impacted by Zika. Like, what's one key takeaway you think they should get?
This is Sherry. I would just say that even if you don't think the parent needs the resource right at that moment, go ahead and give them every single resource you have available, because you never know as our children grow what we might need. And it might be your only chance to get the family that information.
Yeah, and this is Rachel. Just to piggyback off of what Sherry said, we really are encouraging our social workers to connect with these families as soon as they possibly can after we've sent their case information their way. And even if the family doesn't have an identified need at that point in time, just because with Zika, there are still so many things we don't know about Zika, and we want to stress how important it is to follow these families because we don't know at what point these families might need services throughout their child's life.
Right, and this is Jennifer. I would piggyback on both of those to try to provide them with as much information as you possibly can and link them to their community and their health home because sometimes you might be the only contact with that family and they might be moving or you might not see them again, and we sometimes don't see these families or these babies for another 2, 3, 4, 5 months, and we need to make sure that that connection is as valuable as possible.
Thank you. Do we have any other questions? All right, hearing none, we'll go ahead and end the webinar today. Thank you all for sticking around despite having kind of a rough start. I really appreciate the presenters and all the information shared today. Thank you all for joining us, and please stay tuned for information on the next CityMatCH Learning Network webinar. Also, be sure to check your email. We'll be sending out a post-webinar email with an evaluation, and also we can send out the information on some of the resources that were asked for today. And then this webinar will also be posted on the CityMatCH website. So thank you all again for participating today. Goodbye.